Hi everyone, welcome to my YouTube channel, My Health and Me by Fun. Please like, subscribe and share. Hernia happens when part of the body pushes through a weak spot in the muscles or tissue. This can create a noticeable bulge or lump, which might be more visible when you stand up or strain. Imagine a balloon with a thin spot. If you push on it, the weak part bulges out. Similarly, when there's a weak spot in the muscle or tissue, internal organs or fat can push through, creating a hernia. Hernias often occur in the abdomen, but they can also appear in the upper thigh, belly button, and groin areas. This can happen when there's extra pressure on your belly, like when you lift something heavy, strain during bowel movements, or even during persistent coughing or sneezing. Hernias don't always hurt, but you might notice a bulge or swelling. Sometimes, the area around the hernia can feel tender or uncomfortable, especially when you bend over, cough, or lift. It's important to remember that hernias usually don't go away on their own and might need medical attention. If left untreated, they can lead to complications, so it's crucial to consult a healthcare professional for proper diagnosis and treatment options. There are different kinds of hernias, each with unique characteristics and locations in the body. Inguinal hernia is the most common type, especially in men, and happens in the groin area. It occurs when tissue, such as part of the intestine, protrudes through a weak spot in the abdominal muscles, femoral hernia. Also in the groin, especially in women. This type of hernia appears lower than an inguinal hernia and can cause severe discomfort. Umbilical hernia appears around the belly button. It is often seen in newborns and young children, but can also affect adults, especially those who are overweight or have had multiple pregnancies. Hiatal hernia happens when part of your stomach pushes up through your diaphragm. It can lead to symptoms like heartburn and acid reflux. Incisional hernia develop at the site of a surgical incision if the muscle is weakened. Several things can lead to a hernia. Some people are born with weaker spots in their abdominal wall. Aging can also weaken muscles, making hernias more likely as we get older. Straining your abdominal muscles, like from lifting heavy objects, chronic coughing, or even constipation, can contribute to hernias. Pregnancy can also increase the risk due to the pressure on the abdomen, so also obesity. Hernias don't always cause noticeable symptoms, especially in the early stages. However, common signs include a bulge or swelling in the affected area, pain or discomfort, especially when lifting, bending, or coughing, a feeling of fullness or pressure, and heartburn or acid reflux, especially with hiatal hernias. Your doctor might order imaging tests like an ultrasound or CT scan to get a clearer picture of the hernia. These tests help in determining the exact location and size of the hernia. Treatment options vary depending on the type and severity of the hernia. Your doctor will discuss the best course of action tailored to your specific condition. If the hernia is small and not causing symptoms, your doctor might recommend monitoring it. Avoid heavy lifting. Maintain a healthy weight. Avoid straining. Whether during physical activities or while on the toilet, try to avoid putting extra pressure on your abdomen and manage constipation. If the hernia causes pain or gets larger, surgery may be recommended. It aims to strengthen the weakened area and ensure that the hernia does not recur. There are two main types: open surgery, where the surgeon makes an incision to push the tissue back in place and repairs the muscle wall. Laparoscopic surgery is a minimally invasive procedure that uses tiny incisions and a camera to repair the hernia, which can lead to faster recovery. Thank you for joining me today.